Hand washing interaction. Health hygiene is the easiest and most important way to prevent spread of infection. You use your hands of almost everything. They are easily contaminated. Purposes of hand washing. To clean contaminated hands, to remove dirty, minimize number of microorganisms, to prevent cross and nosocomial infection. Indication. Hand hygiene is essential when hands are visible soiled before and after caring for a patient. After contact with organic material such as feces, wound drainage and mucus in preparation for an invasive procedure such as suction, catheterization or injection. Before changing a dressing or having contact with open wounds, before preparing and administering medication, after removing disposable clothes, before and after using the toilets, before and after eating, at the beginning and end of the shift. Stages of hand washing. Before touching a patient. Second, before a procedure. Third, after a procedure or body fluid exposure risk. Fourth, after touching a patient. Fifth, after touching a patient and its surrounding. Hands flora. Resident flora and transient flora different. Deep-seated, difficult to remove, part of body natural defense mechanism associated with infection following surgery, invasive procedures. Transient flora is superficial, transferred with easy to and firm hands. Important causes of cross infection, easily removed with good hand washing. Hand hygiene includes hand washing, washing hands with plain soap and water. Second, antiseptic hand wash, washing hands with water and soap or other antiseptic agent. Third, alcohol-based hand rub, rubbing hands with an alcohol-containing preparation using after hand washing. Fourth, surgical antiseptics, hand washing with antiseptic soap or alcohol-based hand scrub before operation by surgical personnel. Hand care, nails, rings, hand cream, cut, skin problems. Ring and jewelry. First study have demonstrated that skin underneath rings is more heavily colonized than comparable areas of skin on fingers without rings. Fingernails. Keep fingernails short, not excessive 1/4 inches. Avoid artificial nails. Avoid nail polish. Equipment for hand washing. Sink with warm and cold running water. Tissue paper or small towels. Trash can, nail cleaner. Soap dispenser or soap and soap dish. Procedure. Nursing procedure. Inspect and observing for visible soiling, breaks or cuts in the skin and cuticles. Determine amount of contaminate of hands. Assess areas around the skin that are contaminated. Remove jewelry, exploit plain wedding band and push watch and along sleeves object above wrist. Adjust the water to appropriate temperature and force. Wet hands and wrist under the running lower than elbow. Lather hands with liquid soap. Wash hands thoroughly using a firm circular motion and friction. Rub palms together. Rub the back of both hands. Interlace and rub hands together. Interlock fingers and rub the back of fingers of both. Rational rubbing of left thumb. Clasped in right plump and visceria. Rotational thumping backward and forward. Rub both in wrist in a rotating manner. Wash for 15 to 30 seconds. Rinse wrist and hands completely. Keep hands lower than elbow. Dry hands slowly without paper towels. Turn off fetus using a dry paper towels. Use hospital approved hand lotion if desired. Inspect hands and nails for cleanness. Provide patient teaching. Explain to the patient the importance of hand hygiene.